There is a large number of people who believe in the good points of finasteride, and there's an equally large number who would not like to hear about this drug. Consensus is so deeply divided between these two communities. So deep is the divide that this has become an emotional issue for many. I have nothing against those who do not want to take finasteride, but for those who want to take finasteride, I would like to caution them that finasteride is not a drug to be taken lightly. Finasteride should be taken with due caution. People start taking finasteride and then they end up with side effects. Most of these people have not been guided properly. They do not know the pitfalls of following this path to medical hair restoration, and when they fall prey to some side effects which may have been pre-existing because baseline testing has not been done, they become sworn enemies of this drug. And these people are to be found on all forums, all hair loss forums that exist on the World Wide Web. But there are countless people who were initially fearful of taking this drug and now take this drug under my supervision. People who are otherwise healthy and have had a marvelous makeover, a head full of hair, and many of them are maintaining the head full of hair for last 10-15 years because of advice, how to start the drug, how to taper off the drug, how to decrease dosages, taking maximum benefit out of microdosing, and a host of other information that can be gleaned from time to time if the patient is followed up closely by an expert in the field of medical hair restoration. I always bring out the fact that there are 10 mistakes that a patient who is on finasteride should not make if he has to maximize the potential of the drug finasteride and minimize the eventuality of developing side effects from this drug. I have made a host of videos, and you can see the playlist in which there are over 50 videos made on finasteride and hair loss treatment for men and for women, which you can refer to if you still continue to have doubts, lingering doubts in your mind after this talk. So the number one mistake that people make is people take this drug over the counter. Well, in many countries, the usage is restricted, but there are far more countries in which the drug is available across the counter. You just have to ask for it or order it online and you get the drug. This medication cannot be taken by taking cues from hair loss forums, by asking doctors questions in their YouTube comment box. A close, deep counseling session with the doctor is a must, because the doctor will go into your history, your family history of baldness, the grade of baldness you have, the progression of baldness, how fast it is developing, your mental robustness, and above all, your age at which you wish to start taking this drug. A person who has OCD, obsessive compulsive disorder, is likely not a candidate, because every problem that he has after he starts the drug finasteride, he is going to ascribe it to this drug. Because there is so much of talk, cross talk on the forums, he gets convinced that the problem that he's having is because of this drug. The next is changing brands. Changing horses midstream. Every company finasteride is not the same. There is tremendous amount of polymorphic variation in the compound that a particular company has as distinct from the other company's brand. So you have to be careful that when you start finasteride with a good company, a good brand, and there are several good brands available in the market. And do not change horses midstream. Because when you change the brand, there is likelihood of you're developing severe shedding. Severe shedding process will ensue. And many people think that this drug is not working anymore. And this is another reason why people get discouraged and they stop taking finasteride. And even more severe hair loss happens when they stop taking finasteride. Now coming to topical finasteride. Topical finasteride is not an alternative to oral finasteride. Scientific research has not yet made it possible for the entire topical finasteride that you apply over your scalp to be delivered straight to the follicles. So till such time scientific advancements happen and a topical form of finasteride is discovered, which helps in controlling DHT, which helps in controlling hair loss at the follicle level, please continue to take oral finasteride. That is my fervent advice to you. Most people who do not want to take oral finasteride, who are fearful of the drug, they start taking topical finasteride because it is very, very widely advertised, and they think that they should be doing something about the hair loss. It is the guilt that makes them opt for topical finasteride. But over the next 1 year, 2 years, a lot of ground is lost, and this cannot be made up if you start oral finasteride after all the hair have gone. The body is an intelligent complex. It is not a silent bystander when you control the hormonal milieu, when you alter the hormonal milieu by taking various drugs, of which finasteride is one. It responds in varied ways, and every person's body responds in different ways than another person's. It depends upon how the body metabolizes the drug in your case. So when you take higher doses, the body will readjust itself. The body is very intelligent. See, when you get injured, the body kicks in without informing you certain cascades, certain mechanisms which repair the body. It is the body's automatic response to any assault. So when you take finasteride and alter the hormonal milieu, the body is going to respond likewise. If you're taking a higher dosage than the body would allow, the body is going to upregulate the DHT receptors. And there will come a time when the drug will stop having a salubrious effect on your androgenic alopecia. In fact, the body can hit back by what is called as reflex hyperandrogenicity, and I have covered this in this video. And in one of the previous videos done last month, I covered going off turkey when you're taking finasteride. That is suddenly stopping finasteride because of certain fears, or what somebody has said at your workplace or in the family, or a misinformed doctor has told you that finasteride is not good for your health. When you go cold turkey, there is a sudden increase in the DHT level, which may at times completely shut off the HPA axis. And I have covered it in this video. This is referred to by some as PFS, but it is because the HPA axis has been shut down. Sixthly, we go to the important aspect, not getting your blood work done as a baseline measure before starting finasteride. And when you develop side effects because your hormonal milieu is being altered, and we do not know the baseline tests, what was your exact hormonal levels before you started finasteride, you continue to ascribe all the side effects that you get, low libido, pain in the testicles, pain in the breast, brain fog, all this to finasteride. A lot of information is available on the internet, and you attribute all these side effects to the drug finasteride. But the fact of the matter is that you ignore the fact that when you started finasteride, you may have had decreased libido, you may have been impotent, because a large number of the community is suffering from these problems than we are ready to accept. Many say it is up to 40%. And when we don't do the sperm count, and when we go to the doctor, he gets your semen analysis done, and your sperm count is low, many people are going to infertility clinics these days because infertility is on the rise. Almost 40 to 60% couples are infertile in one way or the other, but we are not ready to accept that. We think that the low sperm count is because of finasteride. It just happens that both of these events take place together. It is a young person who goes to the infertile clinics, and it is a young person who's losing hair and who's on finasteride. And I'm not for a moment saying that finasteride does not cause side effects. It does cause side effects, but in a very minority group of patients, that is less than 1.5%. Now, taking the drug continuously, if you're on long-term finasteride, if you started it at the age of 21 and you are to take it till the age of 32 or 35 or even 40, and you take this drug continuously because nobody has informed you that you're supposed to take breaks in between. I'm not talking about taking the drug after hair transplant because you must take it continuously for 6 months. I'm talking about medical treatment for hair loss in men. When you're taking it for thinning hair, you are supposed to take breaks every 3 months for 2 to 3 weeks so that the body washes off the excess build-up of the drug so that you do not have side effects and so that you do not develop tolerance to this medication. And number 8 point, which is very important, is what time you take the medication. Many people who come to me, the drug is not responding, our hair loss is continuing, I quiz them a little and they tell me that they take the drug in the morning. The first thing they do when they get up in the morning after their cup of tea. Well, there is a science behind it. The testosterone surge occurs early in the morning around 7 o'clock or 8 o'clock. And this is a testosterone surge that we need to subdue to prevent our hair loss when we are suffering from male pattern baldness. The half-life of finasteride is around 6 to 8 hours. It means that its blood concentration peaks in 6 to 8 hours. So if you're taking it in the morning, say 8 o'clock, it's going to peak around afternoon when your testosterone levels are on the decline. So it's not going to be effective. Just try taking a micro dose of 0.5 milligram instead of your 1 milligram that you're taking in the morning. Take this 0.5 milligram at night before you go to bed and see how it's going to better control your hair loss instead of that 1 milligram higher dose that you're taking in the morning. So we need to take finasteride late at night so that its peak concentration in the body overlaps the peak of the testosterone surge, which happens around 7 o'clock or 8 o'clock in the morning. This is important. Higher doses of finasteride. The dose response curve of finasteride flattens out at around 0.8 to 1 milligram dosage. Increasing the dosage beyond this to say 5 milligrams a day which many people are taking, is not going to do you any good. The response beyond 1 milligram is not proportionate to the dosage. There is no benefit in starting with a high dosage. You are going to get disenchanted with the drug and you're going to stop it, and that will prove detrimental to your long-term goals of keeping your hair for a longer period of time. And when you take a high dose, the body responds by upregulation, as we've already talked before. Also, you run the risk of developing reflex hyperandrogenicity. And lastly, not taking finasteride when you should be taking finasteride, and taking finasteride when you should not be taking finasteride. Finasteride is a drug which is for male pattern baldness, androgenic alopecia. Many people are taking this drug for thin hair. Well, thin hair may not be in a large majority of the patients because of androgenic alopecia. Some people just have thin hair in their family. Finasteride is not to be taken when your baldness gene is quiescent, or when your baldness gene has switched off. Because if you continue to do that, hair loss will come back with a vengeance to haunt you. So in a nutshell, finasteride is a wonderful drug for male pattern baldness. Most people respond very favorably to the drug, and it is the only good drug which is effective in today's times. But a word of caution, as in this video I have brought out to you that there are a lot of aspects that you have been ignoring till now, which you need to understand and bring into your routine if you're convinced that it is finasteride that will do you good in the long term. So thank you for watching. If you haven't subscribed yet, please do, because only then you'll receive notifications about the next video that I'm going to bring out on finasteride, and that video may be very pertinent for your hair loss, for maintaining the hair on your head, and for long-term health even when you're on finasteride. Thank you for watching. If you have any doubts about hair loss, about hair transplant, then any question that you may like to ask about this video or the previous videos, I'm there to help you. Just drop a comment in the comment section below and I'll respond within a day or two. Thank you for watching and God bless you.